Hey everybody, Saul Marquez with the Health Matters podcast. I'm so excited that you guys are tuning in with us again. Today, I have the privilege of hosting two extraordinary leaders in healthcare here in Las Vegas, straight from the show floor at Health 2023. First, I want to introduce you to Mariya Filipova. She is the Chief Innovation Officer at CareQuest Innovation Partners. I'm also joined by Maria Ryan, Executive Vice President and Chief Clinical Officer at Colgate Palmolive. Welcome to the podcast.
Pleasure to be here.
Pleasure to be here.
It's a privilege to have you guys here. Now, you guys just got off the stage where you had a panel about trends and opportunities in systemic health. Tell us about how that went.
Wow.
I had a blast. I don't know about Mariya. She was doing all the hard work up there moderating. But
it's easy when you have great panelists who have passion and a lot to tell us about oral health. But yes, it was great. We had a blast.
Yeah, and I was glad that we brought oral health to the health meeting, which is really important.
It really is. And there's some important dots to connect here. As two organizations that really have a core in oral health, what brings you to health?
Mariya said it. I think that this is the 6th or 7th year that this conference has been going on, bringing all kinds of specialties and fields of healthcare and medicine together. And this is the first time where the conversation about oral health is present. And we thought it's about time that oral health joins the health community. And we have a lot to say of how oral health can contribute both on the outcome side, but also the total cost of care side of health.
And for us at Colgate Palmolive, it's really our purpose is to reimagine a healthier future for all people, their pets, and our planet. And that's the kind of work that we do at Colgate for the people. Mm-hmm. We are the leader in the oral health business, and we're rapidly growing skin health business as well. And then, of course, on the veterinary side, we have our Hills business. We're here because health is important. But particularly, as Mariya said, oral health has been left out of the story here. And so we're very happy to introduce that to all of the participants at Health.
Thank you both. And having your presence here at this meeting is really symbolic to the change that's actually happening. Mm-hmm. So it's very exciting to see those dots begin to be connected on systemic health, which is a term that I want to dig in with both of you. What is systemic health, and what does that mean to your organizations?
Go ahead. I'm joined with a clinician here.
Yes.
I'll let the periodontist take on this one first.
Yes, as Mariya said, I practiced periodontics for 20 years. And I don't think most people recognize that in the dental profession, we go to medical school for a couple of years. And then we go on to dental school. And it's like a specialty within health. And so we specialize in what happens in the oral cavity, but your mouth is connected to the rest of your body. Mm-hmm. And so what happens in the oral cavity certainly has an impact on the overall health and well-being of people. And there are 3 diseases really that we brought to light in today's symposium. One is caries, which is the most common disease in children throughout the world. The other is gum disease or periodontal disease, which is a disease of infection and inflammation that is the most common chronic condition throughout the world. And the other is cancers, oral cancers, which unfortunately are often detected very late. And the outcomes
has an impact on outcomes. Yeah.
Yes, the outcomes are not good. We certainly, when you think about the systemic health of someone, what's happening in the oral cavity does have an impact on your overall health and well-being. In that, I just mentioned infection and inflammation. Mm-hmm. And if you don't treat infection and inflammation anywhere in the body, it can increase your risk for developing diabetes, make it harder to control your diabetes, increase your risk for cardiovascular disease, lead to adverse pregnancy outcomes, increase your risk for respiratory diseases. So I don't think a lot of people recognize that. And so when we think about systemic health, we think about those connections. And also it goes the other way too. If you're a person who has diabetes and it's not well controlled, you're at greater risk for developing oral disease. So it's connected. It's all very connected.
Yeah, and as the only impact investor in oral systemic health, CareQuest Innovation Partners looks at all these connections that clinicians and leaders like Mariya Ryan just described, and we compare that to the fact that by 2025, oral health spending will be $185 billion. That's 4% of total healthcare spending. And then we compare that to the investments in oral health startups, in early stage startups. That's less than 1% of the investment that goes in healthcare startups. And so we are the healthcare community here where we have innovators and investors and entrepreneurs. And it's our mission, that systemic health connection that is clinically very well established, is actually missing from the investor community, from the business community, and the workflows that operationalize it. So we're very excited about the opportunity and very excited to share that opportunity with the health community here.
I'm super excited for what is happening here. And the systemic health definition that we've discussed today, I think, is something that all of the listeners, you guys can take home with you and start thinking about it for your own organizations, whether you're a payer organization, a provider organization. How are you connecting those dots? And if you're an entrepreneur, right? Let's talk about the ecosystem for a bit, because it takes companies and innovators to make these types of things happening. For everybody listening today, maybe they're a startup looking for advice. They want to work with large organizations like yours. What advice would you give them?
I would say for us, we're always looking for external partners. And we have an innovation portal where people who are interested in working with us can put in and let us know what kind of work they're doing. And then, of course, you can always call me because we develop about 50% of all of our innovations in-house. We have a great team of scientists and clinicians that really work on developing new products and new innovations to improve the health of people throughout the world. However, a lot of work that we do is licensed in, and we do work with external innovators as well. And actually, we've really enjoyed working with Mariya and the team to help some of these new, at least understand the landscape better. At Colgate, we're in 60% of all homes. So I think we have an idea of what people, and we have a great professional business on the dental side, our Colgate Oral Pharmaceuticals, and we understand what clinicians are looking for as well. So we can help them as they begin to innovate and look at opportunities to bring those innovations to the profession that I love, which is dentistry, and to the consumers who really need all the help they can in preventing oral diseases. Many of the diseases that we talked about before are preventable, and detecting them as early as possible. And so some of the innovations that we discussed in today's session really can help us to do that more efficiently.
That's right. And I think what we're seeing as a trend is both organizations, we like to work with companies that are taking on big, bold problems rather than a feature or a technology solution. We're talking about systemic health issues. We're talking about managing chronic diseases. We're talking about minimally invasive care procedures. We're talking about reducing the total cost of care and improving outcomes. It's the same big, bold problem statements that a multitude of entrepreneurs and startups are solving in the healthcare side. So I love to see companies that are solving a healthcare problem. They think it's a healthcare problem, but actually consider adding an oral health intervention or component to it, because I believe that will absolutely improve the end outcome, especially if it has to do with chronic disease management, especially if it has to do with overall wellness, longevity, or quality of life. And so we're seeing the trend of convergence of different disciplines in health, right? The environment you live in, your medical health, your mental health, your oral health are all coming together into this holistic view of health. So we'd like to hear from companies and startups that are looking at health in that way. As I said, CareQuest Innovation Partners makes early stage impact investing. So we are focused on companies that are looking to not only deliver return on investment, but also that are mission aligned. So companies that are looking to integrate medical and dental disciplines, companies that are looking to make care more equitable and more accessible in many ways. And that's a whole new podcast that we should invite us to talk to you about. But that's a very short list of who we're looking to engage with. Yeah.
That's amazing. And folks, the opportunity is big. There are incredible leaders like Maria Ryan and Mariya Filipova that are making moves to create ecosystems that can help us advance care and systemic health overall. I can't thank both of you enough for being with us today on this podcast. What closing thought would you leave our listeners with?
All right. We spend a lot of time together today, and I had consistently 3 specific questions, and I'm going to share them with this audience as well, because first of all, I think that we all have a role to play. This is a community, leaders who take care of patients, leaders who take care of communities, of employees, of our own families. And so when you think about how do we understand the total cost of care for our patient population, our community, or our own family, I ask you, what is the true total cost of care if you're not including the oral health component? And there's so many studies and so many clinical connections and missed opportunities. So what is the true total cost of care? I challenge you to answer our next question. Are you truly taking advantage of the oral health benefits that are available to you? We know that for those diabetic patients who max out their periodontal cleanings and they don't do anything extra, just go out and use up your benefits that you already have available to you. We know that they're more likely to control their diabetes, and we see 14% reduction in total cost of care on the commercial side, 12% on the Medicaid side. So all we have to do is A, understand that oral health is part of total health. And number 2, use up the benefits that are available to us in appropriate utilization, right? We're not asking for people to go in and inappropriately take advantage of benefits that are not appropriate. Finally, because you know me well, I'm all about call to action. The third question is, there's an abundance of opportunities at this conference, abundance of resources and networks and experts. What are you going to do differently this quarter? As a parent, as a member of a community, as a clinician or a business owner, what will you do differently? These are my 3 questions for you guys.
And on our side, I think that certainly I would ask that all the CEOs that are here, the companies that are here at this health conference, have they thought about oral health in the context of the oral health of their employees and the communities that they serve and the work that they're doing? Certainly, if you're developing drugs for diabetes or helping to manage people with diabetes, you're not going to get very far if you don't understand what's going on in the oral cavity.
Yep.
And that is true of a number of other diseases that we mentioned before. Think about the oral health and then think about how can you empower your employees to get the services that Mariya talked about, to ensure that they utilize the services you may be providing to them. And we work as a company at empowering consumers. And knowledge is power. And unfortunately, oral health literacy is very low throughout the world. So we've created a campaign called Know Your OQ, Know Your Oral Health Quotient.
Nice.
Like people know their IQ or their EQ, and you could take a little quick quiz
Love that.
at knowyourOQ.com and find out how much you know about your oral health. And it's interesting to see, and we find that people spend a lot of time on that site. So there's a thirst for it. Provide people with the opportunities to learn more about their oral health and how that they can become more empowered to help themselves with preventive strategies which are accessible to them. And I think that those are important things for us to be thinking about.
That's outstanding. Thank you both for those calls to action. And finally, if the listeners want to get in touch, what's the best place for them to reach out and get to know more about you?
Certainly for me.
Apparently, you could call Mariya directly. So
Watch out. Be careful now.
I think my
People will
husband
call.
that's a new one.
But certainly emailing us, Mariya_Ryan at colpal.com, or you can find me on LinkedIn. And I'm always happy to talk to people. It's exciting that we're here, and it's exciting that we have the opportunity to work with more people through all of the connections that we've made here at the health meeting.
That's right. And I echo the same sentiment. You could find us at CareQuestInnovationPartners.com. I am M for Mariya Filipova at CareQuestAsia.com and on LinkedIn And I'm very happy that we got to connect today. And feel free, Sol, to share that email address in the notes from that podcast.
Absolutely. We definitely will. So folks, thanks for tuning in to this amazing podcast. As Mariya mentioned, everything is available in the show notes. So a quick way to get in touch with both Mariya Ryan and Mariya Filipova, making a big difference here from the Health Conference on Systemic Health. Thank you both for being with us.
Thank you.
Thank you.